In this video, I will talk about what are the pros and cons of an ER tech. Hi, my name is John. If you don't know, I used to be an EMT working in Los Angeles for 10, 24, and 48-hour shift before I transitioned into a trauma hospital and psychiatric hospital. So let's jump into the topic. What are the pros and cons of an ER tech? Pro, you will get a lot of experience working as an ER tech inside the ER department because your responsibility as an ER tech, you will be either working independently or assisting the nurse and the doctor with their procedure in the ER. If you want to become a nurse or a doctor with an emergency specialty, ER tech is a good job to learn the rope. Especially in the ER, you will be asked to assist the nurse and doctor with a lot of procedure. During that time, you could interact with nurse and doctor, learn the rope, and kind of shadow and kind of be their apprentice, learning what you are expected to do in that situation. Eventually, you ask for help to recommendation on what you're going to be doing in the future. As an ER tech, you will have a lot of hands-on experience, especially direct patient contact in the ER department. So if you applying to med school or any school related to medical that need direct patient contact, ER tech job is a good job that gives you a lot of skill and experience and fulfill the direct patient contact hours. A very good interactive learning experience in the ER. As an ER tech, you will be interacting with nurses, doctor, NP, PA, different medical staff, the administration, and sometimes you will ask to help the nurses transport patients to the lab, to ICU, CCU, or to the med floor. So you will see a lot of different type of level of patient. So ranging from minor injuries to full-on trauma, like car crash, broken bone. And you also see a lot of psych patient and mental health patient. Con, you will be very busy in the ER. It's an ER, so sometimes there will be a downtime, but overall, most of the time, it will be very, very busy. And as an ER tech, most of the time you will be expected to do your independent tasks. If you don't have independent tasks, you will be assisting the nurse and the doctor with the procedure in the ER. Constant movement. You will be always on your feet. As I previously mentioned, ER gonna be busy. So during that busy, hectic time, as an ER tech, you will be moving around, helping the nurse with activities, tasks, and then helping the nurse moving patient, transport the patient. So my recommendation, have a good pair of running shoe or any type of shoe that you're comfortable wearing for a long period of time, because you will be moving and on your feet for the whole schedule. Most of your time will be in the ER, therefore you will spend not that much time with the patient unless there's no bed for the patient to move to due to max capacity. But remember this, in the ER, the whole point of ER is to stabilize the patient and then get the patient to another unit. So usually ICU, CCU, or go to the med floor. So your interaction with patient is going to be shorter compared to other department, but you will see more patient because of constant influx of patient coming in from the fire or from ambulance. So you see more patient, but less personal development between patient and ER tech. High stress is emergency department. So you're going to see a lot of different type of injury, different type of trauma, different type of patient. And remember, as an ER tech, you are expected to able to function independently on your own. Most time you will assist the nurse, but you are expected to able to do your job without supervision. It's gonna be a lot of emotionally draining. There's gonna be a lot of cases where you can see a lot of sad situation, ranging from like children abuse, children sexual abuse, to elderly abuse. Like when I was working in EMT, I have brought an elderly patient to ER for elderly abuse. When I'm working in the trauma hospital, I have seen kids involved in car accident, like trauma. I think for me, the one that hit the hardest is kids and children, or baby. And remember, you are working in the ER, so you have to be calm and collected when you see this thing, and you want to focus all your attention on caring and taking care of those patients. So you cannot have a breakdown. And at the same time, there will be a lot of crying, screaming, a lot of people will curse at you because they are in pain, or they just don't know how to express themselves. Like personally for me, I have I have experienced like racism. I have seen people, like patients have cussed me out just because they're in pain, and just we had to communicate well. So have a good communication. Don't take it personally. Don't take it personal. Work thing out. If you need support, talk to your coworker. But understand that this is an emergency department, so you will see a lot of bad situation, and sometimes there are patients that we cannot save. So patient will die in the ER. Like we are not like miracle worker. Like we will try to save all the patient, but some patient by the time they get to the ER, it's too late. And remember, if you watch my my videos, you know that I used to work as a patient transporter, where I take patient down to the morgue. So I have took patient from ER to lab to MRI, and then an hour later, I got a call and say, "Hey John, I have the patient you took earlier. That patient need to go down to the. I have a body go down to the morgue." And it's a tough situation because an hour ago, I was talking to the family of that patient. And then now I have to take that body, seeing the family member face while I'm taking body down to the morgue. It does take a toll on you. So my recommendation is that be prepared. And if you have, it's going to be a lot emotionally draining and mentally. You need to have a support group. You need to talk to your coworker. If you have a tough day, talk to your coworker. Talk to someone that know what's going on. Because there's some day that could be really tough to be in the ER. Like working as an ER tech is going to be rough. So take care of yourself. Well, I hope you learned something new from this video. What is your thought on the pros and cons of an ER tech? Comment down below and like and subscribe. On this channel, I talk about my life experiences and my journey in healthcare. Okay, I hope you have a good day. Take care of yourself, believe in yourself, and love yourself. And I will see you again on next video. Okay, bye. Take care.